Good afternoon, everyone. Thank you so much for joining me today. I'm Jenny Montgomery. Welcome to another half hour of information to help you make the most of your time, to make informed decisions, and to keep up with goings on around Greater Augusta. And let me tell you right off the top, musical theater fans will want to order your tickets now for an event happening this weekend. Les Reagan's here to tell us about the Augusta Broadway Singers' latest show. But first, March is Endometriosis Awareness Month, and we're devoting most of this show to talking about this disease, which affects nearly 176 million women worldwide. The big question is, how do women know they have it? Well, endometriosis is a chronic, painful disease that's often tricky to diagnose. The three main symptoms are painful periods, painful intercourse, and infertility. If these symptoms sound familiar, pay attention.
The best way to explain endometriosis, although there are other theories of how it originates, the most accepted theory is retrograde flow. So what that means is that the tissue, part of the tissue that is released with a woman's menstruation each month, a portion of that backflows through the fallopian tubes and implants in the pelvis. Again, there are other theories, but that's the most widely accepted one. And the implants have different types of lesions. They go from being fresh to coagulated to ultimately scar tissue. Stage 1 being the mildest form, stage 4 being the most aggressive. Milder stages can absolutely impact both pain symptoms and fertility. And the way that it does that is because those lesions release inflammatory substances. And so when a patient is having their menstruation, those lesions are also bleeding inside of the pelvis. And the molecules and substances that are released are extremely inflammatory to the pelvis, specifically the peritoneum, which is basically a layer that covers our intestines, and can cause that pain that most patients complain of. Endometriosis as a disease is considered a surgical diagnosis. There's a laparoscopy required. Basically, we put a little camera in through the belly button and look inside for lesions, and in that way we're able to diagnose the disease. Outside of doing that, what a lot of people will do, even ourselves as infertility specialists, to treat pain symptoms is basically an empiric treatment of 3 months. So we give the patient a trial of 3 months of hormonal suppression. Typically that's done with oral contraceptives or birth control pills. And if patients report improvement in their pain symptoms, then the suspicion for endometriosis goes up. And this may be a less invasive way of trying to assess for the disease. Specific with fertility, it's a little bit different conversation. The surgical diagnosis still remains as an option, particularly for patients who are not well controlled on birth control or whose pain symptoms are affecting daily life. They're calling out of work, they're not able to be intimate with their partners. So definitely that still has a role, but for the fertility patient, the goal of obtaining a pregnancy precedes controlling any other symptom. And in those cases, we tend to counsel them on fertility treatments before we discuss surgery. I would say if it's something that's bothering you enough to impact quality of life, or if it's something that has been progressively worsening with time, then it's absolutely something that needs to be addressed.
It's important to note that even following a diagnosis and treatment, endometriosis can recur. Doctors often recommend women maintain hormonal suppression to keep symptoms at bay. This is a subject that is very personal to me because I struggled with endometriosis from the time I was a teenager until I had a total hysterectomy in my late 30s. Getting a doctor to believe something was really wrong was the first hurdle. So many brushed it off as being in my head.
Endometriosis is often a really difficult disease to diagnose. It's often that the extent of symptoms don't actually correlate with the extent of the disease. I've had many patients who present with infertility and no other symptoms, undergo a laparoscopy or keyhole surgery and be found to have extensive disease. I've had other patients with extremely severe symptoms have a laparoscopy and be found to have very, very minimal disease. It's often difficult to diagnose, and it often takes a good 10 years to make the diagnosis because the symptoms are so vague.
So I did finally get a surgical diagnosis laparoscopically at Duke University Medical Center when I was 20. It seemed that once I had proof on my side, my doctors took me seriously. I was fortunate to have specialists through my 20s whose main goal was to preserve my fertility, and that did happen thanks to hormonal and surgical treatments. Even though I had a partial hysterectomy at 26 and lost my right ovary and tube, I managed to have 3 babies when I was 31, 32, and 33. Still ahead on Jennie, meet a woman whose endometriosis battle affected every part of her life. She's written a book about it and a workbook for other patients to follow. We'll meet her right after the break. Welcome back, everyone. This is Endometriosis Awareness Month, and we're devoting a big portion of this show today to a woman who has written a great book for other patients and other women who are struggling with what is often a debilitating disease. Samantha Bowick's book is a guide to risk factors, symptoms, and treatment options. It's called Living with Endometriosis, and there's a companion workbook and daily journal that really help you keep your information straight and your medical concerns documented for your doctor's appointments. I'm so pleased today to have Samantha here in the studio with us. And Samantha, thank you for being committed to raising awareness about women's health issues.
Thank you so
much.
much.
And you're so young to be having to go through this. Samantha is just now 29, but you had to have a hysterectomy 6 years ago for endometriosis. So before we get to the hysterectomy, just sort of fill us in about, you knew from the time you started your period that it was a problem.
I did. Thank you so much for having me, Jennie.
Sure.
So I actually started my first period when I was 13 years old. I remember missing school. I would spend days in the bed in pain. I had really heavy periods, and I just didn't feel like it was normal. I couldn't wear tampons because they hurt, so I would have to wear pads, and I would soak through pads in a few hours' time.
Yeah.
And I have a younger sister, and she didn't experience that. And so we were trying to figure out what was going on with me from the very beginning, really.
That's interesting because it was the same way with my sister and me.
Really?
And I had just the terrible cramps and would miss school as well. And it got to the point where it had to be shots of Demerol to get through the first couple of days. I would just have to get knocked out to get through it. And then my sister barely had a cramp. And you're like, how can our experiences be so different? So the first thing, again, is just getting the diagnosis and the frustration of getting a doctor to believe that it's not in your head.
Yes. So I went to my first gynecologist when I was about 16 years old and started telling her my symptoms. And she wanted to put me on birth control, so I started birth control then. It didn't really help. So a few months later, we decided to do laparoscopic surgery. And she did find endometriosis, and she said that she removed it all, except what was really close to my ovaries, because she didn't want to mess with that. But she burned the disease rather than cut it out.
So that was a laser laparoscopy where she went in and was able to burn that. And I had been through that as well, and then apparently had really bad scar tissue from it.
I'm sorry.
And so then but it is that scar tissue that can continue to cause problems later. So did you then have to have different kind of hormonal suppression outside of the birth control? Did they try other things to stop your periods?
Yeah, so after that first surgery, she told me there was nothing else she could do for me. So I went and found another gynecologist, and she wanted to try me on different medications before doing another surgery. So probably the year after that first surgery, I went on different birth controls. I tried pain medications. I actually tried Lupron, which is an injection that they give you every 3 months to completely shut down your ovaries. And so I did that. I've had a total of 3 injections of that. And now I have osteoporosis, and I'm pretty sure it's from Lupron and having a hysterectomy too.
Back in the 80s, it wasn't Lupron, but it was a treatment called Danazol.
Okay, yeah.
And I had to be on Danazol for quite some time, and you would have to take it. I had to buy what was really a cool thing way back in the day with a timer on my watch, because I had to take it every 12 hours. Every 12 hours. So I had a timer that went off, and for months and months and months had to take that. And again, that was shutting down the ovaries, because that was keeping what they felt was keeping the endometriosis from spreading.
Right. Yeah.
What made your doctors and you decide at 23 that a hysterectomy was the option for you?
Yeah, so I actually had another surgery after my second one, and I didn't really find any relief, and they were all 3 ablation. I didn't know the difference between ablation and excision at the time, so I went to another doctor, and I told him, I made a list of all the treatments I had tried, everything I'd been through, symptoms I was experiencing, and he said, yeah, you've been through a lot. If you want to have a hysterectomy, I'll do it for you. So we went ahead and did that. About 3-4 months after that, I was still experiencing symptoms. I was trying to go to pharmacy school, and I ended up having to leave twice because of my pain and symptoms that I was experiencing. So I had the hysterectomy. A few months later, I found an endometriosis specialist, and he did excision in Atlanta. And since then, I haven't had any symptoms related to endometriosis.
But how frustrating to have such a, that's a real final thing when you do a hysterectomy.
It really is.
And even though, for me, I knew I was through having babies. I knew I was very lucky to have had babies. But I just remember thinking, wow, okay, this is really the end here.
Yeah.
This is never going to happen again.
Yeah.
And you knew at that point that there was, you were cutting out any option of trying to be able to have a baby.
Yeah, I did. I had actually never tried to have a child, so I don't know if I would have been able to or not.
Right.
But it was a very difficult decision, and after having my hysterectomy, I went through a lot of feelings, feeling not like a woman, for instance. And so that was really hard to deal with, and I can connect with different people having a hysterectomy and experiencing those type of feelings. But since then, I've come to terms with it a little bit more. I think time has helped a little bit too, and I do know that I can adopt.
And that is one of the things that you get to talk about in your book, and we're going to hear a lot more about Samantha's books when we come back. The books are Living with Endometriosis and the workbook and journal that accompanied us. Stay with us. We'll have more after the break. And welcome back. We are talking today with Samantha Bowick, an endometriosis patient and author who's using her own journey to help guide others through the complicated world of diagnosis and treatment. And these are her books. This is the book, Living with Endometriosis, that really documents her incredible story about making some really tough decisions at a young age, and what she had to do for her quality of life because of terrible endometriosis and terrible menstrual cycles. One of the things that I am really impressed that Samantha has done is create an endometriosis workbook and daily journal. And this is a terrific way for people to keep up with what's happening, medications, treatments. Tell me how you decided to do this.
Yeah, thank you. So I remember whenever I was really young, I didn't document anything up until I decided to have my hysterectomy in 2014. And so looking back at that, I wish I would have had something like this. And I've had people talk to me about ways that they could keep track of different things. And so that's why I created the workbook and daily journal. And
you go through this, and it's more than just documenting what's happening with your cycle. It's life stuff. It's things to be grateful for in your life. It's reminding you to pause that you are more than your endometriosis.
Right. Yeah.
And I think anybody who has suffered with this, I know I felt like a big part of my life was defined by endometriosis.
Yes, and I have too, yeah. Whenever I had my hysterectomy, it was tough for me to remind myself of things that I was grateful for because I was so stuck in my feelings, and so that's why I added that portion.
You know, if anybody gets a pass for being stuck in their feelings, Samantha, it's a 23-year-old having a hysterectomy.
Thank you.
You must have had a lot of support from your family.
I did, yeah. My parents and my siblings have been great. And then I have extended family too that have been very supportive, always checking on me to see how I was doing after surgeries and just different symptoms too. Yeah, they've been great.
It makes you feel so isolated sometimes.
It does.
When you're having a situation that friends and other people your age aren't going through.
Yeah. Yeah, that was tough. I've actually lost friends because of that. So like I wouldn't be able to go out and do things that normal 20-somethings can do. And so I would have to cancel plans and they just didn't understand. So that was difficult too.
When my doctor talked to me about hysterectomy after my third baby, she said, you know, Jenny, at this point, it's a quality of life issue. You're missing work, you're missing out on things, and there comes a time when you have to think about, you have to weigh the options.
Right.
And that is something that you had to do at a time when your friends were graduating from college and starting their careers.
Right.
And you're having to make such a big medical decision.
Yeah, it was definitely difficult, and without the support of my family and friends, it would have been so much harder.
Did you have any kind of pushback from insurance companies, or was it the sort of thing where your doctor was able to get that taken care of?
Yeah, I actually didn't have any pushback from pharmaceutical companies or insurance, but I did have pushback from a doctor. So I actually had to go to a second doctor who would agree to do the hysterectomy because my first doctor wanted me to go to counseling before she would do the operation.
And I guess these years since then, you can understand her perspective.
I can, yeah. But thinking back to where I was at that point, I was so upset whenever I got the phone call saying that she wouldn't do the operation for me, because that's what I felt like I needed. And for her to, I guess, take away that decision from me and prolong it really was very frustrating and upsetting.
The prolonging it, I understand what you mean when you say that.
Yeah.
Right. Well, I really want to encourage you, if you have endometriosis, if you have a daughter or a niece, anyone that you know with endometriosis, these books could be so helpful to that person. And you can find Samantha's books at several sites online, including Amazon. She explains the latest hormonal and surgical treatment options, shows you how to become your own best advocate for your health care, and lists important resources for women suffering with endometriosis. And again, I can't say enough good things about the value of the workbook and journal. Samantha, once again, I just want to thank you for your honesty and being so brave to talk about this. And thank you for the many women that you are no doubt helping with your books.
Thank you so much for having me, Jenny.
Certainly. Up next on Jennie, Les Reagan joins me with a look at a wickedly enchanted evening coming up this weekend. So many of your Broadway favorites, from Oklahoma to Wicked. Stay with us. As conductor of more than 30 musicals, Les Reagan realized the thing that kept him coming back to musicals was the ensemble music, the choruses, and that's what led him to found Tabs, the Augusta Broadway Singers, a fun group and very talented that performs fantastic choral arrangements of showstoppers we all know and love. And I am so happy to have my pal Les with me today. Tabs has a show coming up this weekend, the 20th and 21st, and you've got all the details for us.
I do. It's one wickedly enchanted evening, and it's all the wonderful music of Oscar Hammerstein, Richard Rodgers, and Stephen Schwartz.
Such popular
Yes.
composers, and it's the kind of thing where your audience is just going to know so much of the music.
They will. I've decided for this program to go back and bring in a lot of the classics from Carousel, from The Sound of Music, from Pippin, from Wicked, just phenomenal things. And we're bringing back with us the group Voce, the Young Voices of Greater Augusta.
Oh, right.
So the children are going to be singing with us again under the direction of Lori Van Linton, and they're such a wonderful group of children. They have some special things that they are going to do. So a couple of things from The King and I that will involve the children there. And they're singing a few numbers with us as well.
Oh, that's wonderful. And I bet the contrast of the voices is wonderful.
It's great.
With the children's voices and then your very developed, mature voices in your Tabs group.
Yes.
Wonderful, wonderful singers. Now, this show is going to be at St. John's United Methodist Church,
That's
downtown
correct.
on Green Street.
Yes, ma'am.
So is it in the sanctuary? I mean, people are just, so it's like a concert in the in the church.
It will be in the sanctuary there at 736 Green Street. It's a wonderful place to sing. I've sung there many, many times, and just the acoustics are wonderful, and a lot of various groups have performed there.
I want to show you this poster. It's just terrific. You saw a little bit of video of it earlier, but you have the playbills from some of these very, very popular shows, like, for instance, Wicked. Okay. Is it For Good? You're going to do For Good, aren't you?
We are. Well, actually, the Tabs group is not, but Voce is actually going to do For Good. And I do have a soloist that's doing Popular from Wicked, which is another hugely fun song.
Fantastic. Well, once again, we want to show you the show is called One Wickedly Enchanted Evening, and it's presented by the Augusta Broadway Singers with special guests Voce. Coming up Friday and Saturday nights at 7 p.m. at St. John United Methodist Church, which Les said is downtown on Green Street. You can get your tickets in advance by going on to tabsaugusta.com, or you can call the number there on your screen at 706-267-1240.
Thanks so much for having me.
Have a great show. Absolutely, Les. And that is all the time that we have today. You'll find lots of information about Samantha's books and the Tabs Wickedly Enchanted Evening concerts on our website, WJBF.com. Just click the JENNIE link. I hope you have a wonderful afternoon, and remember, everyone has a story to tell if you'll take the time to listen. I'll see you again next Tuesday at 12:30 for JENNIE.